thinking of having this session since so many
Yes,
months.
yes. But then there is so much more that happened in these past months, which has really told us that we are on the right track. So it's God sent. I take it like that.
Yeah, okay.
And how have you been?
Yeah, we are also fine. Third wave, we were waiting for the third wave, but let us see what happens. We are still waiting. I mean, let us wait till Diwali, then only things will become a bit more clearer. But we
Okay.
have started having classes in a hybrid mode, which is even much more difficult than having online classes.
Yes, yes, that is true. That is
Those
so
are the
true.
challenges that we are facing right now. But then, yes, I think in another month or so, we will get some more clarity.
I guess it is. This is going to be the new way of communication. We'll have to learn how to operate like this.
Yeah, pure online is okay, but then once it becomes this a kind of mixture, it becomes a problem. To
Yeah.
manage both online and offline is very difficult. I think Diksha's link had gone to everyone, so everybody is now
Yeah.
logging in the name of Diksha. We have number of Dikshas. We don't know which is the real one. Diksha
Even
is the
your
real
name
Diksha.
displayed is Dr. Diksha Gautam.
Oh, I didn't even understand.
So, in fact, I just called up Jen to say that Dr. Shutpa's name is display name is coming as Diksha Gautam. So please have it changed because these webinars, what happens that if you register separately, then your name is picked up. But if you copy paste and log in from the host ID, then it
Yes, then
displays
it's
the
the
same
same.
name.
Yeah.
Yeah, now it is coming, Dr. Shutpa. We have so many Dikshas here.
Bela, you'll have to rename yourself.
You,
Yeah. Hi.
Hi, Dr. Bela.
Hi. I'm Meena. Sorry, I am a little late. Actually, last minute one patient just walked in.
Okay. Ma'am, you have to rename yourself. You are showing as Diksha Gautam.
Okay.
Yeah.
Is it? I
Yes.
don't how do I do that?
Just click on the three dots on your
Oh
picture.
yeah. Oh, oh
Just
yes,
click on
yes.
that. It will say rename.
Oh, how do I rename?
Just type in your name. That's it.
Oh. Done.
Yeah. And for others also, Dr. Diksha, the original Dr. Diksha has sent a message that those who are displaying their name as Dr. Diksha, please change it. Now I can see a little less of Dikshas. Thanks, Divya, for changing. I think, Dr. Sanjay, let's wait for another 2, 3 more minutes and then we can start. It's 4:05 by my watch.
No issue.
Yeah, just another 5 minutes. Even our students are joining. They just finished their class.
Is it okay if we start at 4:10? Right now
Yeah.
it is 4:05,
Yeah.
so we'll wait for 5 more minutes.
5 more minutes. Yeah. Diksha, we can start.
I think, yes, ma'am, I think we should start now. We have 51 participants, so let's start the session. So very good evening, dear participants and honorable speakers. Welcome to the webinar on transgender healthcare management, delivering gender affirmative holistic healthcare, hosted jointly by IIHMR Delhi and Ati. Thanks for joining us. IIHMR Delhi is a part of the IIHMR group of institutes. So, and it is involved in managerial skills improvement and capacity building activities for health professionals through three verticals: academics, research, training, and consultancy. With its core values of quality and accountability, instead in all activities, the institute is committed to supporting programs that benefit the underprivileged through trust, transparency, and knowledge sharing. We pursue avenues to contribute to social equity in healthcare performance. So let's begin the session. Let me share it with you. Is the presentation visible?
Yes, Diksha.
Yeah. Introducing myself, my name is Dr. Diksha Gautam, and I am Business Development Officer in Trainings at IIHMR Delhi, and I'll be responsible for moderating today's webinar session. So we have been privileged with the most eminent speakers on board. That is Dr. Sutripal Yogi, Director from IIHMR Delhi, Dr. Sanjay Sharma, who is CEO and Managing Director from ATI and Board Member of WPAC, Dr. Bela Sharma, who is Additional Director in Internal Medicine from Fortis Memorial Research Institute, and Ms. Nikita Sabharwal, who is Associate Dean and Trainings and Associate Professor from IIHMR Delhi. So most welcome, sir and ma'am. So let's begin the session. So as we know that after almost 3 decades of fighting, transgender community in India has achieved a huge success when the Supreme Court decriminalized same-sex sexual acts among consulting adults in 2018. But a robust healthcare system still falls in gray area, which needs to be focused to demand a better and more inclusive society. So today's webinar will be throwing light upon the field of transgender healthcare management and adopting a better holistic healthcare approach to lay down the benchmarks in the delivery of standardized healthcare to the transgender community in India. So let me take all my pleasure of introducing the most esteemed Dr. Sutrapa Yogi ma'am. Dr. Sutrapa is a dynamic public health specialist and presently director of IIHMR Delhi. She is MD in Community Medicine from PGI Chandigarh and DNB in Maternal and Child Care. She has received the prestigious Kataria Memorial Gold Medal in 2001 for her academic credentials. She has a rich experience in public health, particularly in the implementation of epidemiological and clinical research-based projects centered around maternal and childhood with great relevance to national policies and programs. She has authored several research papers and is a reviewer of many national and international journals. She is an associate editor of BMC Pregnancy and Childbirth. She offers her technical services to various academic and research bodies in the country, including WHO CRO, Ministry of Health and Family Welfare, Save the Children, JAPIGO, Nutrition International, Norwegian Indian Partnership Initiative, etc. Thank you so much, ma'am, for joining us. I request you to begin the session with your final words. Over to you, ma'am.
Thank you, Dr. Diksha, and a very good afternoon to all who are participating in this very important session. We all know that health for all is a, very common dictum, especially for those who are working in public health. Unfortunately, we have not been able to address all the factors that have led to inequitable services till date. Several challenges come to the forefront whenever we talk of barriers to delivery of services. And some of these include socioeconomic factors, lack of access to basic amenities and facilities, financial barriers, lack of competencies of the healthcare sector, sometimes discrimination, and also lack of sensitivities on the part of the healthcare system, especially for those who are vulnerable and marginalized. And one such category is that of transgender population. So we should try to understand and convince ourselves that healthcare needs of transgender population is same as that of cisgender people. Healthcare services require multidisciplinary approach and requires multidisciplinary caregivers, including doctors, staff nurses, managers, and support staff. And we do need people from all specialities to work cohesively for caregiving, especially to this important sector of our population. Different models for providing comprehensive care are available in tertiary facilities. Even then, it is very difficult to find a place or any hospital where all the requisite services are available under one roof that are required for transgender healthcare. We know that 80% of our people seek care from the private sector. However, orientation and sensitization of care providers across every health setting seems to be a missing link. There is no provision for insurance coverage for this group, and stigma is often reported not only from the patients but also from the care providers. And not only this, there's a requirement for provision of skill sets for optimal management, which includes both medical and surgical care, and equitable allocation of resources based on the priorities of this vulnerable group is the need of the hour. So, as a fraternity that works for better management, it is our earnest duty to sensitize people who matter the most. With the current commitment shown by the existing and amended laws, we should try and build up a community that is sensitive to the needs and demands of transgender population. So I believe that if we join hands together, we would be able to create an enabling environment in all the hospitals wherever we are working. So with this, I welcome you all for this important webinar, which I believe will enlighten us with facts and figures. And this will stimulate us to think and help us design solutions, especially for this group, that would be doable and scalable in the long run. So thank you once again and welcome you all.
Thank you so much, ma'am, for telling us that why there is the need to step in to take care of this community. So for our next round, I would like to introduce Dr. Bela Sharma, who is the Additional Director in Internal Medicine in FMRI. Dr. Bela is presently working as an Additional Director in FMRI, Internal Medicine in Gurgaon, where she heads the Department of Preventive Healthcare and Lifestyle Medicine. She has completed post-graduation in Internal Medicine from JNLC AMU Aligarh. Dr. Bela has served in the IIHMR for 5 years as an SSC officer, and thereafter she worked as a physician nephrologist. Health education and awareness has always been a passion for her, and it came to fore as a parent of a transgender child. She is keen to share her experience and knowledge with other parents on the personal front and help them overcome the health-related issues as a professional. So I'd request Dr. Bela to throw the light on why there is a need to address this major health challenge in the transgender community.
Thank you so much for those kind words. Can I? Just a minute. Can I?
So you can share your presentation.
Yeah. Show my PPT, please. And Dr. Sutapa has already actually shown some of the whys of transgender healthcare. Can I see my PPT, please?
Just a minute. It's
yeah, sure.
I'm not able to get this.
So basically, we will be talking about why do we require gender affirmative holistic healthcare management, since we are talking about a holistic care. And we will be talking about why it is required and why it is relevant in today's day and age. while Sanjay is loading the presentation, I will just take you through the background. WHO has already confirmed in 2018 that gender diversity and gender unequalness isn't a disorder as was thought earlier. It is a normal variation. And so now we have this subset of human beings who are coming to us with variation. And the world as seen is not binary. And we need to celebrate all colors and hues of human forms.
Bela, just hang on. I'm not able to share the screen. Diksha, you'll have to help me out, please.
So earlier it was shown a little.
See, when I go on to scale, it's showing Microsoft, SharePoint, OneDrive, Google, Box. So,
sir, if you there, sir, is it open in your menu bar? The presentation.
the presentation is open on my menu bar.
So it might be showing in the below options. There must be showing the presentation as well.
No, it's giving in Microsoft Word, WhatsApp.
Or if you can share the PPT with Diksha, maybe we will help you.
Yeah, I'll do that.
Yes, sir.
So meanwhile, can I just carry on?
Yeah, I think Dr. Bela, you can carry on. I mean, you have got so much of experience, you really don't need a PPT to run through.
Sanjay, what do you say?
Yeah, please carry on. I think that would be a better thing, God's
Yeah.
will.
Yeah.
So by the time you can share the PPT with me.
Yeah.
So what I was saying is that human beings are not really binary, and we need to celebrate this all these colors of all and colors and hues of gender diversity. So and if we look at the statistics in India alone, and see the statistics that I'm going to talk about are the statistics that are coming to us from these so-called clinics or hospitals, and they are about 2% of the total population, and that is a very conservative figure. But in a country like India, even 2% population, it runs into, I was calculating yesterday, it is like about uh, 3.5 to 4 crores of population, which is quite huge. And this is just tip of the iceberg. If we look at the whole umbrella LGBTQIA plus, then the population probably would be about in the about 15%. And you can think about a population of nearly 1.4 billion. 15% of that would be a very, very high population. And this is the subset of people we are talking about who have not really been talked about as far as healthcare is concerned. Now, that is why we need healthcare solutions for this particular marginalized of the marginalized community. Now, the next thing that comes to mind is what are the healthcare requirements and why do they require healthcare especially? Because this is the population that has seen an increased prevalence of mental health problems. Practically each and every person has some kind of mental health disorder at some point of life. Then there is an 40% more chances of some kind of self-harm, including attempted and probably successful suicide attempts. Then they are more likely to have substance abuse problems 10 times more than that of the other population. Sexual diseases sexually transmitted diseases, including HIV and AIDS, are very highly prevalent in this population. In fact, they are considered to be a high risk as far as sexually transmitted diseases are concerned. And if all these things do not kill them at an early age, violence against gender diverse people, sexually different orientation people is very, very high, with the result that there is a decreased life expectancy and most of them do not reach the fourth decade. And please remember, this is a very big population that we are talking about. And these are people uh, we like me and you. Fortunately, there is a light, and affirmative was participated care leads to better health outcomes. So that is why we need gender affirmative healthcare facilities. Another why answer to why is that the perceptions are changing. Now, this is a population that is now coming to hospitals and healthcare facilities to ask for care, not cure. They are individuals, they are not patients. So we as healthcare providers, we as administrators, we as organization need to look at them as individuals, not as patients. We need to look at them as beings and not bodies or diseases. And we need to look at them for providing care and not cure. That means we need to look at, we need to change our viewpoint. We need to change our attitude. And mind you, we are looking at a population that has, as it is, a very poor health seeking behavior, because right from the beginning, their narrative has been negated. They have always been in a constant and continuous negative environment, at home, in school, in playgrounds, wherever. So they need to have a positive reinforcement, especially at a healthcare place. Fortunately, Government of India has now started working towards it, and you would be pleased to know that India is one of the few countries which has taken up this matter very seriously. In the wake of Nalsa judgment, which happened in 2014, uh, in 2019, the Transgender Protection Act was passed, which said that a transgender person can affirm one's identity, can get a certificate from the district magistrate, can apply for change of one's name, can apply for a certificate, can get the privileges according to a person. Then in 2020, the rules were passed, which ironed out all the difficulties and the problems that were there in the act that was passed in 2019. And also, it ensured that there would be reservation in the jobs, in the schools, and there would be, okay, all right. So in 2020, the Transgender Protection Act was passed in 2019, and the rules came out in 2020, which gave further strength to the act that was passed in 2019. Along with this, the National Education Policy was also developed by the Ministry of Human Resource Development, which again which talked about training the teachers and the trainers, so that there will be no discrimination against the students, there will be no bullying in the schools, and there would be teachers would be sensitive to the requirements of the students, so that there would be no dropouts from the schools, and the children can study and be be educated in whatever fields they want to be. Close to the heels of the national education policy came this judgment from the Madras High Court in 2021. This is the later, which was in response to a petition which spoke about taking out the transphobic and homophobic references from the medical books. Because as we have mentioned earlier, medical education so far has been totally binary. So there has been now a judgment which says that all these words, all these references, which were binary, which were transphobic, should be removed. So now that the government has taken this stance, we need to make changes in the. I think Sanjay, you will have to go. This all I have already spoken. I don't think people need to see this. Let's go ahead. Yeah, this is done. Yeah. So now we need to make a change in the medical curriculum, and that इसके पीछे one slide back, this. So we need to talk about the medical education, which is under the purview of National Medical Council, which is the highest authority of the medical education. And there we are talking about not only making changes in the medical curriculum, but also having transgender medicine and transgender surgery as a separate vertical, and to have post graduations in transgender medicine and transgender
Ma'am, sorry
surgery,
to
so that
interrupt you here. We can see
yeah.
Sanjay's screen as Google, not the slides. We're unable to see the slides. We can see the Google page, sir. Dr. Sanjay, if you can cancel the share, we can see your Google page.
Okay.
Yeah.
Dr. Sanjay, sir, please stop sharing the slide. I have shared it from my end.
Yeah, I think Dr. Diksha's screen is being shared. I can see the slide.
Now we can see. Now
So
we
you
can.
so you can stop sharing. Yeah.
Yeah, I've done that.
I can see can you see the slide now?
Yes, it is about the changing curriculum.
Yeah, absolutely. Because earlier I have already spoken about the previous ones. All right. So now we're talking about having separate verticals as transgender medicine and transgender surgery. And we're talking about having post-graduation in transgender medicine and surgery, so that specialized care can be given to individuals who are seeking that. Not only that, NCERT is also being directed to educate and sensitize teachers starting from the primary school to higher education, so that the children and teachers can be sensitized and can be taught about gender diversity, gender forms, and there is no there is no discrimination right from the beginning, and there are no dropouts from the school, and education can be completed right from the primary to whatever higher level children want to. Can I have the next slide, please? So now there is a change in the paradigm. There is a shift. Not only are we changing our attitude, back, please, not only are we changing our parameters, the individuals who need care are demand a change. And so till now, the standards that we had, the standards of care, they were only Western standards. We were depending upon WPATH, which is the World Professional Association of Transgender Healthcare. But we did not have any Indian standards. What we want is an affordable and available and standardized care. and the care should be standardized for our population, which now we have Indian standards of care which were brought out last year, and this has now become a standard to be referred to for any transgender care, whether it is surgical or hormonal or mental or any other kind of surgical, any other kind of care. And along with that, now we also require training and skill development. So this is why whenever a person requires care, would need to know the person I am going to, is that person skilled enough? Does that person have proper training? Does that person know what to do? Does that person have enough knowledge? Is that person up to date? So that is why we require gender affirmative healthcare clinics, places, hospitals, education centers. So I think that is the, and I would not say a very vast, but a short answer to the why. And we would be looking towards organizations like yourselves to go out and spread the word, and students who are listening to, who are watching these webinars, to come up with more solutions, with more ideas, so that this subset of our society gets the best care in our society. Thank you so much.
Thank you so much, ma'am, for highlighting the harsh realities that is occurring on ground, and the transgender people, they are facing the health problems, and what are the changes that that should be bring up, that that has to be, that is required across the country to bring the change. So thank you so much, ma'am, for highlighting things. Let's move on our next speaker, Dr. Sanjay Sharma. So it's a great honor to introduce Dr. Sanjay Sharma. Uh, Dr. Sanjay Sharma is the CEO and Managing Director of ATI and a board member of WPAT. He has the distinction of being the first consultant administration of the Armed Forces Medical Services. He is an alumnus of Armed Forces Medical College, Pune, and College of Defense Management, Secunderabad, where he underwent the prestigious High Defense Management course and completed his master's in management studies. He is a multifaceted personality who during his career has been responsible for providing primary and secondary medical care to the personnel and families residing in Air Force stations and has commanded 2 Air Force hospitals. His area of interest has been in the delivery of social and community health care. His personal journey and first-hand experience of being a parent of a transgender child struggling with his identity has prompted him to seek voluntary retirement from the IAF and dedicated himself to work for the welfare of the transgender community by raising awareness and providing holistic health care. Thank you so much, sir, for joining us. So let's hear out Dr. Sanjay on what should be the approach to accomplish the aim and how we can go.
So like all difficult topics, I'm going to give you a difficult task of trying to make me the co-host, because that will permit me to share the screen. So if you can just do that, let's just give it a...
Yes, sir.
And while she does that, let me not stop. See, now that we know the why, I have this very interesting task of addressing the what and also the how of how we are going to leverage transgender healthcare management into delivering holistic healthcare to the transgender population. A lot of us, when we thought of this concept, said, why go into management for all this? And as you've heard the so many whys, it becomes clear that when you have so many factors which are, and each one is more important than the other to ensure that health happens. And here, when we speak about health, it is not only physical well-being, it is mental well-being, it is social well-being, it's spiritual well-being. And if we want all this to happen from one place, which we traditionally know to be a place where people come to get their diseases cured, then this becomes a challenge. And that is why we thought that let us talk to the management people. And even better, let us talk to healthcare management people who will then be able to tell us as to how to go about this. So let me make one attempt at sharing my screen. Let's see if I can succeed.
So there's no need to make you co-host. You can share your screen. Right now you can also share your screen.
PPT open, then we can also PPT open. Okay. Where do I close this? Okay. अब इसको ऑन किया, शेयर ज़ूम पर जाइए, ज़ूम तो खत्म हो गया। Wow. So I've succeeded.
Yes, sir.
Can you see my screen?
Yes,
Okay.
sir. It is.
Okay. So let's get on to the what. And it's always better to put things in perspective. So I'm going to be covering the what under these headings. When we are looking at what needs to be done in our existing healthcare facilities to make them comfortable for people who traditionally avoid healthcare facilities due to their experiences which they've had, due to the judging attitude of healthcare providers, due to sometimes not even being allowed to enter the facility. We have so many stories where the or the gate man has not allowed a person who looks different to enter the healthcare facility. Sometimes the language is so bad that the person does not dare to go there. So when we are talking about what needs to be done, which relates to the person who has come to our facility, and what needs to be done by the personnel who are there, then the first thing that needs to be done is to be mindful of the language. Use the words which are used at home, which are not derogatory. Use the name which the person wants you to take. Don't use the dead name. And most importantly, don't assume, ask. Use the pronouns that the person is wanting you to use. And it always helps if you yourself have your nameplate which states your name and your preferred pronouns, so that it gives an indication to the person that yes, here is a person who's going to be comfortable with whatever I narrate. This is a person who's going to believe my narrative. Put signages around in your healthcare facilities which indicate that yes, you understand diversity. Maybe a transgender flag, maybe some rainbow colors, maybe your lanyard would be rainbow striped. Maybe you have a badge which says that I have been trained to be gender friendly. create an ambience which would be welcoming. Mind you, this person is very apprehensive of what is going to happen, because herein he or they have come to ask for care. They know they are not diseased, but then do you? The second very triggering thing for them is the documentation, because the transgender people, they have something written on their Aadhaar card which their mind does not agree with. This is not what I affirm to. This is not the name that I want to be known by. The sex assigned at birth does not match the gender that I affirm to. So when we document, when these documents are to be prepared, then we do what is known as a two-step documentation. And this two-step documentation essentially means that you note the name and the sex assigned at birth as given in the documents that are presented. But you also note the preferred name, the preferred pronouns, and the affirmed gender of the person. In all documentation that moves inside the healthcare facility, be it from one healthcare provider to another, or between the staff or maybe the paramedics, the document that will move will have the name on it, which is the one that the individual wants, the pronouns that the individual wants, the gender that the person affirms to. Your staff needs to be trained to do this. The staff interactions need to be with the individual in a manner which does not assume, which gives a sense of comfort. It always helps if I can see somebody like me. So for the healthcare facility, it is very important that in our policy, when we employ people, we employ diverse people. We make sure that people of different gender expressions are there in our healthcare facilities, so that the individual can relate to the person. When we talk about infrastructure, we need to understand that when we are talking about transgender healthcare delivery, then this needs to be done through what is known as a gender affirmative care center or clinic. This may be a part of your healthcare facility, or it may be a standalone center which is entirely dedicated to transgender health. Today, we don't have these centers. Today, at the most, what we can hope is that one would look at gender affirmative care clinics or centers which are part of a larger place or space in the hospital. The managers need to understand that if you have a person who is who would have poor health-seeking behavior, then the exit and entries to this place should be separate. The layout should be such that the individual does not need to go around from pillar to post looking for the consultation that he wants or for the diagnostics that they need. The reception area should be such that the person is able to approach, or if they are not, if they are hesitant, then the reception staff is so tuned that they approach the individual and help them with the documentation. The waiting area needs to be such that the person does not become overwhelmed with too many people sitting close. So we look for seating which is done in a manner that allows people to sit in small groups. The utilities and washrooms are areas which everybody needs to use. But then are they gender friendly? This is something that the manager of the facility needs to look at. Is the signage okay? Because if I am not affirming to the she that has been placed on the washroom, or if I feel uncomfortable going to the he that is placed on the washroom, then I would rather not go there. So all washrooms in the healthcare facility need to be gender neutral. You could say all gender washrooms. Same goes for consultation chambers. Privacy is something which is sacred for everybody, whatever gender expression they may have. Is our consultation chamber so constructed that the physician or the care provider is seen to be very authoritative, is seen to be sitting from a position of superiority? So we design consultation chambers which are so to say open design, where you sit at the same level as the individual so that a conversation can start. Because after all, like Bela said, these are not patients, these are individuals. They have not come to you with some disease, they are looking for care. Examination rooms need to be well lit, they need to be comfortable. The gowns that need to be given should be as per the comfort of the individual. Also, we should ask ourselves, is it really necessary for the person to expose everything? Or will it be comfortable, or will I get my information by postponing this step or doing a graded examination? Do the procedure rooms look after both the feminine and the masculine? Just because we have a person who looks masculine does not mean that he will be able to urinate in a pot that is made for males, traditionally made for males. Would it not be easier to have both and leave this choice to the individual? Same thing goes for diagnostics. And diagnostics are places where everybody is in a hurry. So the diagnostic technicians, they need to be trained, they need to be made even more gender sensitive, they need to look at privacy, and all the points that I have made till now, they need to be considered. When I need to get admitted, if I need inpatient care, then this needs to be given to me in a place of where I am comfortable. So the ward that is allotted has to be as per the desire of the individual. Sometimes healthcare facilities get very sticky about this. Just because your document says female, but you are presenting in a masculine way, you feel you affirm to a masculine gender, you are put in a place which makes you further uncomfortable. Surely no treatment will happen here. And how difficult can it be to assign at least some space where, if that 2% of your clientele walks in and says that this is the place that I feel I should be, that we can make that space available to him. We need to look at our systems. We need to look at our procedures in place. Are we following standards? Are we following procedures that are uniform? Be it for delivery of interventions that take place at the healthcare facility or for procurements. Do our systems cater for the special needs of the trans individuals? Because if we have a trans individual who requires probably dilators post-surgery, and these dilators are not available, or when we ask the individual to go and procure these on their own, these incidentally fall under the category of sex toys, and the individual may not be able to procure them. Do our healthcare facilities know about this and talk to the customs, get the procedures done so that whatever is needed for the people who are diverse is made available to them at the healthcare facilities? How are our teams faring? The team that is required to give gender affirmative care is called a gender affirmative care team. because care for a person who's diverse cannot be done by one individual. It requires a mental health professional, it requires an endocrinologist, it requires a surgical specialist, it requires a person who is part of the ethics committee, it requires a person from the legal cell. And together, they need to understand what the individual desires, lay in front of him what we can provide, and move on to an informed consent model. So these gender affirmative care teams need to be assigned and need to be in place much before the person who wants care steps into our facilities. So these systems need to be done. We also need to have these great teams which will look after the other aspects, because like we said, this is a place where we want to give both medical and social aspects of care. So these great teams need to be made of gender sensitive people who are ready to respond and redress, who are there to educate and execute the policies that are laid down, who stand by the individual and are advocates for them, who help them do the administrative activities that are required. And most essential, they are there to train others. The hospital policy or the healthcare facility policy needs to be put up front and needs to state that it is a zero tolerance policy. The redressal mechanisms need to be exhibited. The telephone numbers put there. The person who's assigned to look at redressal, his name should be displayed. Legal aid, if required, needs to be given. Ethics committees need to be made. Ongoing education, training, and research, these become a very essential part of healthcare facilities which want to look at transgender health or for delivery of transgender health care. Hence, these facilities need to be geared up to run short-term courses for ongoing education of their professionals, of their paramedics, of the nursing staff, of the society at large, who they can invite to come to their facility and learn. What better way to increase footfall in a healthcare facility than to be known as places where you can learn? Maybe a weekend workshop, maybe a seminar. You need to open positions for people who want to know more about transgender healthcare, who want to study transgender medicine or transgender surgery, to be able to do internships with your trained professionals. You need to make an environment which is able to collect data, write papers, and publish them, because you'll be surprised to know that such a large area, or the subcontinent, which houses 1/5 population of the world, and we have hardly any data. We really don't know how the bodies here behave. We really don't know what is the experience that the people with gender diversity have over here, and these need to be documented. Certification is a very important activity, and certification comes with protocols in place, with procedures in place, and with checks and balances in place. Certifications are needed for staff to say that, yes, I certify that my staff is gender friendly. Certifications are also required for the entire healthcare facility, just as we have NABHL certification or NABH certification. The moment anybody sees these logos on the website or on the documents that are presented by the hospital, they know they are they are going to get point of care. They know they are in safe hands. So similarly, I request that we push for certification, a gender-friendly healthcare facility certification, which should be given to the facility where more than 80% of the staff is gender sensitive, where ongoing training happens periodically, where policies are vetted by community members and are gender friendly, where we have ethics committees, where we have gender affirmative care teams, where we have great teams. Those are the places we want to certify. The best way to increase footfall is to be known as the people who stand with the people who come to their facilities. And that, dear friends, happens when you do advocacy. When you take out campaigns which are in line with what the community wants, when you become visible during the Pride month that goes on, or you can have a campaign which goes the year long. You can have some writings, you can do your press and media coverage, which will again make the facility more gender friendly, be visible. Outreach programs that happen from the healthcare facility will reach out to that segment of people who have still not dared to come to you. And hence, these are activities which need to be undertaken by the healthcare facilities. Dr. Bela had beautifully showed us that the act is there, the policy are there, and now we read in the newspapers that so many new schemes are coming up. Are your healthcare facilities linked to these schemes? If not, then you're going to miss the boat. So you need to have those linkages. You need to be able to share data with the government agencies. If we have young children coming in, then we need to build up this data of the gender development that is happening and share it with the Indian Academy of Pediatrics. We need to share data with NACO. We need to share data with the Ministry of Social Justice and Empowerment. And these linkages are, again, very important things which need to be done by the healthcare facility. Well, now that we know what needs to be done, how do we go about it? Well, the answer is very simple. It's a public health approach. And public health approach, because transgender health is multidisciplinary, multi-speciality, involves multiple ministries. And Dr. Sutapa right in the beginning said so. And I very firmly believe that it is the public health which will be able to give the solution. And that is why we are talking to you. We are talking to people who are in healthcare management to make this happen. We need to understand that we are now viewing people and not patients. We need to address both medical and social needs at the same place. And we need to deliver care rather than cure. So, public health approach rests on 4 pillars: knowledge, healthcare, empowerment, and mainstreaming. For knowledge, we require a strong document, a base document, which gives us those protocols with which we can give the point of care, the standardized care, make the care affordable and accessible. We need to train our staff at the center of excellence, at places where these trainings are done. One such center of excellence is being proposed to be set up at AIIMS, New Delhi. This is something that we are pushing with the Ministry of Health and Family Welfare, so that each and every member of the healthcare facility does go out of the hospital, get trained and come back. We need to teach transgender medicine and surgery to people who are going to be delivering this. Again, a proposal has already been sent to the National Medical Council for revising the graduate and the postgraduate curriculum. We need to do targeted IAC activities. And this is one certificate that I want to share with you. This is something which is targeted. If you notice, this is a birth certificate. But what makes this birth certificate unique is that it says parent's name. It does not say mother's name or father's name. What is further unique is that it states that sex assigned at birth is male, female, or ambiguous. Gender to be affirmed by the child later. Now, when the doctor hands over, or when the nurse hands over this certificate to a new parent, just imagine the dialogue that will take place. Will the parent not ask that, why have you written sex and then you have gone on to mention gender? Would not this be a very interesting place to start a dialogue wherein we can educate parents, we can educate nurses, we can educate doctors that look, sex and gender are two different things. Sex is assigned at birth and gender is affirmed by the child later. Can we not do a little bit more of out of the box thinking and develop more such forms which start conversations, which educate? Can we not target or make the healthcare facility gender friendly using the online platforms that we have? Get people on board and teach them. Use your own staff to do this training. We have one such initiative that we have put on, and it's a free online certificate course which we have put on our website. And this is for anybody and everybody who has got anything to do with healthcare. We generally, this is all about gender sensitization and training of healthcare professionals. Similarly, can we not call those school teachers to listen to our faculty who has designed a gender-friendly educational facility initiative? Teach them about gender, teach them about sexuality, so that when that child is there in their classroom, that child does not get ostracized. They are ready to be there to give a nurturing environment. It helps do gender sensitization for teachers. The online platform is phenomenal. We have so many gender sensitization workshops happening. But can this not be done by the healthcare facility which intends to be known as the place where delivery of transgender healthcare takes place? The parent support groups are very important groups, because parents can be your allies. They can be the bridges which can help you talk to the individual, talk to the child, make them understand what you are delivering. They can be the people who can help you do redressal of grievances. They can also be the people who can be the watchdogs. The healthcare facilities need to take up collaborations with other educational institutes, with places like the Global Education Institute of WPATH. We just finished a webinar series with LHMC. And this is a very interesting series because this was initiated by medicos, and medicos who are LGBTQ friendly. This is one way of making the healthcare facility gender friendly. We can also align with what the government is doing. So when we know that NACO is coming out with the Sampoorn Suraksha strategy, wherein it wants to reach to the unreached people for prevention of HIV, can we not visibly partner with them? Can we not share our data with them? Can we not give them space in our healthcare facilities to be there with them? So we come to the next pillar, which is the healthcare. And healthcare, like I told you, needs to come through this gender affirmative care clinic. And I know that all healthcare facilities do not have the infrastructure for having separate institutions. But can we have a space which is close by to where the tertiary care is being given, where we can at least look at the access, have a separate exit and entry? Instead of the individual traveling to the departments, let the trained people from the departments travel to these spaces, which we can call as gender affirmative care centers. We need to empower our client, because once our client is knowledgeable, then the footfall to our places are going to increase. So we clarify what is there in the act. We also need to do this so that we do not get on the wrong side of the law. We know NAPO is already doing so much. We already have a document which gives the standards. We also have the Ministry of Health and the Ministry of Social Justice and Empowerment covering the other aspects. They are moving at a very rapid pace to set up these facilities where the transgender surgeries will be done, where the transgender medical affirmative interventions will be provided, where the mental health facilities will be given. And I was just speaking to Dr. Stupar before this webinar that luckily by the time we were scheduled to do this webinar earlier, and in the interim that the delay happened, we saw that the government has put out another scheme where it is now going to look after the insurance aspect also, and it is going to make the care affordable and accessible. We need to be there to take advantage of what all the facilities that have been put to us. Lastly, a way forwards. We in the Indian subcontinent had always respected diversity. We had put it on our temple walls. Diversity was something which was second nature to us. It was that oppressive rules and that successive oppression that happened by invaders from outside, which wiped this whole culture out. Isn't it time to reclaim it? And with this thing in mind, we got talking to the countries in the Indian subcontinent, and we have proposed a unified approach to transgender healthcare in the entire Indian subcontinent. And we have talked to Bangladesh, we have talked to Bhutan, we have talked to Myanmar, we have talked to Maldives, Pakistan, Afghanistan. Yes, these countries which have so much of trouble and strife, they have people who want to help. And they look to India to be the leaders. And when we tell them about the Center of Excellence that is coming up, when we tell them that the healthcare management institutes in India are thinking about transgender healthcare, they are really excited and they are eager to be part of this journey with us. When we are able to channelize knowledge, which is coming right across from overseas down to India, and share this with the countries in the subcontinent, we will also get data, which is so important for research, which is so important to know whether we are on the right track. This data will start flowing back to us so that we can be better in the delivery of health, holistic and complete health to this beautiful segment of normal people who come under this umbrella called transgender. I have finished. If there are any questions, queries, or clarifications, I'm there to answer.
Diksha?
For the participants, I would like to remind that they can submit all their questions or thoughts in the chat box so that they'll be picked up later in the open house discussion. Thank you so much, sir, for putting up your thoughts and putting up and showing us the path to move forward and the approach we can achieve, how we can achieve it. And as you have correctly said, that they are not the patients, they are the individuals, and we need to care, not cure. So the framework that you have shared, if implemented well, will definitely bring a lot of change, positive change in the community. Thank you so much, sir. So now I would like to introduce my next speaker, Ms. Nikita Sabharwal. She is the Associate Dean in Trainings and Associate Professor in Hospital Management. Has over 18 years of experience across corporate sector, corporate healthcare by qualification. She is MSc and a PhD in healthcare management. She has also done advanced quality management from IIHMR and healthcare quality. She has successfully completed her advanced quality management program from IIHMR. Ms. Sabharwal has worked with various top corporate chains like Empress Apollo, Fortis Healthcare, Max Healthcare, Medicare Healthcare Private Limited, Asian Institute of Medical Sciences, Indeed Medford Hospital Private Care Limited. She is also a NUB assessor and JCI trained. Thank you, ma'am, for joining us. I request ma'am to put her thoughts on already existing interventions that are going around the country and how we can involve the private sector in upliftment of the transgender healthcare community.
Thank you, Diksha. Good evening, everyone here. Thanks to Dr. Shrutika for joining us, Dr. Sanjay, Dr. Bela. I mean, not much is left to say, but then honestly, whenever I think about transgender health and whenever I hear Dr. Sanjay and Dr. Bela, it gives a real deep thought that why, in spite of being in healthcare and managing quality in hospitals for over 19 years now, why nowhere we ever thought about transgender community, their needs and what problems they are going through. So as rightly said and covered well by three of my speakers here, the transgender health, if we have to make it as a part of our mainstream healthcare delivery, it has to start right from the childhood, not for the community but for the people at large. They must understand right from the school level, as Dr. Bela was mentioning, colleges, spread the sensitization in RWAs, make them a part of our community, which we see them as somebody else whom we can't relate. People see them with not somebody who they would like to relate with. So that is where there's a need of sensitization and making people understand that they are among us. So talking about healthcare deliveries, as Dr. Sanjay very beautifully expressed, that there has to be a center dedicated. So for one of those coming from the hospital industry, as I say that, like a preventive health checkup department in the hospital, similarly, why can't we have a transgender health community center where entry exit is separate and people are sensitized? So it's actually not about the healthcare, the treatment facilities available. It is about bringing them on board with you to make them feel normal, to make them feel part of us. So a lot of gender sensitization is needed. As Dr. Sanjay was saying that, there's a need of certifications to be given that we are gender sensitive organization. I would say that a little one more step ahead is not certification, is actually accreditation. When we talk about NABH, when we talk about JCI, these are accreditations which are voluntary. So once it comes from you as a management that yes, we want to go ahead and do it, then it actually imbibes into the system that it inculcates that culture within your organization, that yes, this is a part of our system, and as we are taking care of any community, we say that people below poverty line, or there are certain beds being allocated, so there, it is high time that we start looking the care delivery in for them in a very, very normal fashion. And also I feel that there is no need to discriminate or say that these are centers only for transgender community. We, though we have to take a lot of we are far, far away from this to make them part of our mainstream healthcare delivery. So as I was going through that, what uh, government is doing, and how big is the gap, which Dr. Sanjay, every time we interact, sir talks about it, and on the ground reality. But it gives me a little ray of hope to say that yes, certain governments and certain states are taking some steps, at least a beginning, to put in a little effort towards the transgender welfare. So as I picked up a few from the net, the Rajasthan government has set up a transgender welfare board, among first in the country, for social and financial upliftment of the community, and bring its member to the mainstream. The state government has also allocated about 2 bigha of land near Jaipur state for to develop a community and an old age center for the community, and with 7 divisional headquarters. So this is something which is really encouraging, and seeing that where we see that there's so much of gap, and the care is not being delivered to the transgender community. At least government is started to recognize, and a lot of effort has gone from Athi to bring the government on board to understand. So as Rajasthan has done, Telangana has also launched its first 2 transgender clinics in Hyderabad, which is Hyderabad is important because it is being HIV is very prevalent in that city, and the clinic is completely led by transgender representatives and welcomes any member of their community. So that is a very important part to make them feel comfortable. And this transgender community clinic very well fits with the USAID mission and objective to accelerate project to prevent the HIV and support ART treatment services. So, going along the same line, Chandigarh has also established a legal clinic called Samta Naye Kendra, which are again working with the transgender community, working in also in AIDS Control Society as an NGO. So that is, these are some steps which is being taken. Coming to same steps, some government of Odisha, Assam has also taken these steps. Now, in the current situation of pandemic, it would also be worthwhile to understand that what steps are being taken, and we all have gone through our phases of handling the pandemic, the family members and all. But it is also very important to see that how this community has also suffered. So there are few little steps which are being taken that in support of COVID vaccination for this community. So Delhi government established a exclusive COVID vaccine center in Sultanpuri area, where the privilege is only given to them, because it involves a lot of stigma and general dysphoria in public places. So they were also not very forthcoming for these COVID vaccinations. So the Sultanpuri, there was a camp being dedicated for 4 days exclusively vaccinating transgenders. We also see that the Poonawalla Foundation and Apollo hospitals have come together to accelerate the vaccination in this community. 2.5 lakhs Covishield vaccines were procured by Apollo Hospital and given vaccinations to the community. So it has to be a multifaceted approach. It has to be like a PPP model, the government coming together. And as Dr. Shutpa said, that 80% of our healthcare is with private. So this is prudent that the private healthcare steps in and takes a step forward to establish these centers work, and we are, as an IHMR Delhi and Athi, we are more than happy to collaborate and make this a reality, that they are a part of our community, they are a part of our mainstream and not being discriminated. So thank you so much, Diksha, for giving me an opportunity to say. So this is actually coming from the heart, and what I've been hearing from Dr. Sanjay, who's very, very passionate about the cause, and so as Dr. Bela. So thank you, Diksha, over to you.
Thank you so much, ma'am, for enlightening us with the ongoing work that is being done in the field. A lot of work is being done in the lab, and we are hoping for more to come. So I would like to start the open house discussion now. Whoever has their thoughts in mind or any question that related to this can ask to unmute themselves.
You may please raise your hand, and then Dr. Diksha can call out names, which will make it a little more organized. Or put your questions in the chat box.
Okay, so Hema Chaudhary, I've requested you to unmute yourself. So yeah.
So my question is, ma'am, like you have told so many schemes in Rajasthan and Telangana and all that. So how does it reaches to the community? I mean, how will it reach to the community? That is my question.
Yes, Hema, is the question to me or to Dr. Sanjay?
Yes, ma'am, to you. You just explained some schemes.
Okay. So yeah, so that's what, see, this entire bringing the transgender community into mainstream is the essence of doing all these efforts to bring, doing this online seminars, reaching out to people like you who understand the sensitivity. So similarly, we see that yes, some steps are being taken by the government, and the government machinery will have to come into action to reach out to. I mean, it is like any other healthcare program, like vaccination, like COVID vaccine, the way it has been disseminated to the entire country and reaching out to the last person whom we can reach out to. In the same fashion, the government has to spell out a more constructed approach so that it reaches to the community and they understand that yes, the government is with them. They're not doing any favors to them. This is a part of a healthcare program of the country. But Sanjay, if you like to add anything here?
Yeah, so Hema, how this works is that the government, specifically the Ministry of Social Justice and Empowerment, they have taken the lead as far as these schemes that which ma'am was just talking about. So these are spearheaded by them, supported by the Ministry of Health and Family Welfare. They take the help of what are known as community-led organizations. So CBOs is what we call them. These are NGOs which are of the community, and they take on whatever is given by the government and they translate it onto ground. So if the government has said, okay, there needs to be a shelter home that needs to be made, which is what happened in Telangana, Hyderabad. So there was two NGOs which came forwards, and they identified the space. The government gave them funds. They had their community representatives who actively participated, and that is how the scheme got translated. So there was a felt need for a clinic to be started over there. So the NGO or the community-led organization, they touched their collaborators across the seas, and the funds were added, projects were made, and people were employed, and the scheme starts running. So the government works in a private-public partnership kind of a module. There are certain things that is owned by the government. So like what is written in the Transgender Person Act is actually things which the government is supposed to do, because the Act very clearly directs them
that you need to set up one tertiary care facility in each state. And once that has been done, now the government is working towards that. While the government will move at a slow and steady pace, which is probably it is administratively a good practice to do, because that irons out stuff. The community is invited to participate. So you'd be happy to note that the stepping stones have been put down there by the government. They are encouraging the community to come forwards. But you must also understand that when we talk about equity, then it is up to us who are at positions of privilege to step out. And like when you attend this webinar, and when you go back to your place, if you are going to now at least do this small thing of meeting a person with diversity and not making them further uncomfortable, you have done your bit. If you further go on and you go and educate another person the difference between gender and sexuality and how what your opinion is has space among what my opinion is or what ma'am's opinion is. Nobody is asking us to change anything. We are just saying that there is space enough for everybody to coexist. If we are citizens of this beautiful country, then we all have the equal privileges. And it is up to people with privilege to provide that equity. I hope I have answered your question and stimulated you to at least pick up your, paper and pencil and start writing something to stimulate others, and maybe ma'am here will build up a paper and we'll have some more solutions coming in. The solutions have to come from you. We are already beyond the age of, so we are passengers now. You have to make the change.
Yes, sir. Thank you so much. Thank you so much, ma'am.
Thank you, sir. Anybody else? Anybody else needs to ask any question or give their suggestions or views? Kindly raise your hand.
So if there are no questions, we can probably wrap up the session.
Yeah, I think the session was very clear to all the participants and they have enjoyed a lot. So thank you so much, all the speakers. I'm sure everyone who watches this is now and later will have a lot to think about and join hands to work collaboratively towards achieving the success. And thank you so much, all the participants, and we appreciate your being with us today. So we encourage you to connect with us on social media and other platforms. And if you have any future additional questions or any doubts or any thoughts in your mind, you can contact us by email or telephone. We would be very much happy to provide this for additional information. Thank you so much, sir. Thank you so much. So we'll wind up the session.
Thank you. It was a pleasure to be here.
Thank you, everyone.